All right, so it's me again. I've been asked to give some closing remarks for today. Thank you. First of all, I just want to thank all of our panelists, our moderators, our organizers for hosting such a wonderful and insightful event. You know, I've got AI in my title. I'm literally paid to think about this all day long, every day, and yet I've learned so much, really, from all the people here. And it reminds me of what Julia said earlier on. You know, sometimes we need to kind of stand outside of our own silo because we have so much more to learn from each other. So I've been working in clinical AI for the last decade, but I've witnessed, and I think all of us have witnessed, an incredible transformation in just the last 12 to 18 months. For many years, AI has been focused on very narrow but important clinical use cases. For example, trying to identify diabetic retinopathy from an image. But when you talk to patients and providers, these were often viewed as just incremental improvements in care, not transformative. And this was evident when you talk to our providers. When you talk to providers about clinical AI, the general reaction that I got was one of skepticism. And many providers even felt threatened by AI. They felt that it was threatening their sense of professional competency, their sense of autonomy. But something really changed with the advent of generative AI. Suddenly, we have general-purpose AI tools that are showing impressive performance across a very wide range of use cases. Moreover, these tools are starting to solve some of the quality of life pain points that clinicians have always struggled with, things like administrative burden. And what surprised me most is the physician change in attitude toward these tools, from one of skepticism to one of delight, and now what I'm facing is one of incredible demand. Now, the promise of these AI tools to me is, paradoxically, they make medicine more human again. These ambient scribes that we talked about allows providers to turn their attention away from the computer screen and back to patient faces. It gives providers more time at the bedside or in the exam room. And so hearing these benefits, you might think that the natural approach is to move forward as fast as we possibly can. But I think that to move faster and to move further, we have to proceed with caution and vigilance, especially now. Why? Because I believe in these tools, and I also believe that nothing slows innovation more than patient harm, or algorithms that promise more than they deliver, or biased algorithms that mimic our history of inequities or biases. Now, at KP, I have an incredible privilege and responsibility to help lead our organization's program on responsible AI. For us at KP, responsible AI is a journey. It's not a destination. And just like everything at KP, we strive for excellence, not just compliance. And so what does excellence in responsible AI look like for us? First, it starts with culture, and it starts with system guardrails. So I come from the world of patient safety and healthcare quality. And if there's one thing that I've learned from that environment, it's that to err is human. And so we have to apply that same approach to our AI algorithms. Our algorithms, like humans, are intrinsically fallible. There is only one way to prevent harm and to prevent bias in health AI, and that is to never deploy it at all. But there's a risk in that approach. If we all believe in the transformative, positive benefits of AI, we have to acknowledge that there's risk in deploying AI, but there's also risk in not deploying AI, the opportunity cost. The only way that we can manage this tension is if we move forward with a culture of responsibility that travels from frontline providers all the way to the most senior executives. We also approach responsible AI as an organizational muscle. We understand that our providers are extremely busy, and so they look to us to do rigorous QA testing on these algorithms, to identify risks and mitigation strategies, to provide actionable education on how they should be using these tools, and to create system guardrails that prevents harm from happening in the first place. But we also realize that our upfront risk assessment and mitigation strategies just provides preliminary guidance. We also have to learn by doing. And in order to do that, we need the discipline and the infrastructure to monitor the performance of algorithms we've already deployed, looking for drifts in performance, the introduction of new biases we hadn't thought about. We need the discipline to quantify the real-world impact of our AI algorithms, what I describe as these algorithms' return on health. And we need the infrastructure to flag and remediate patient harm before they occur, and to learn from these system errors, what Laura talked about as a learning health system. So as I said before, the work for responsible AI is never done. It's a journey, not a destination. And so in closing, I invite you all to join us on this journey. If I've heard one thing today, it's that the stakes are too high for each of us to be doing this on our own. I really hope that industry, policymakers, health systems like KP and others can partner and share their expertise and their perspectives as we think about national frameworks for advancing responsible AI. We've got so much to gain from learning together. Thank you.